and I close my eyes. But actually you hear the TV sounds or someone is in the living room. That is the stage you are at. You're not fully awake. You know things that is happening. So that is the stage. That's where we can do our hypnosis.
Feel ni
Itu memang topik
pancreatic cancer.
Bersama saya Dr. Roland Victor.
Satu benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden.
But at every second of your life, you either earn or learn.
Okay. A bit of a sleazy question on that. So when we say that we are in the stage where this is the best entry into the brain, can this also be used by a lot of things? For example, our media, they are subconsciously programming us. And when we are watching
advertisement is one good. Yes, one advertisement is good. That's why advertisements are using this technique.
So they are technically programming our brain.
Finger licking good. So that's why you keep on taking the drumstick. That's how it's being used.
And when we are doing rawatan and we're doing a treatment for this kind of individuals, I mean, there's no medicine, tak ada ubat, everything, but it's much more of a keeping them calm, discussing the concerns and slowly taking them to the zone where they need to heal. Is that true?
Yeah. There's no medicine. The medicine, I always tell them, is inside you. No need.
And your task is to guide them into that.
We are just a guide, bringing them into the subconscious stage and see what is the thing that is troubling them, and allow them to understand the messages or information in there. Then from there, they make a realizations.
Understand. And usually, how long a therapy would last? Berapa lama untuk satu individu? Is there a specific time, or some people mungkin akan ambil lagi lebih masa, or is it like therapists are like trained like how to navigate complex issue? Maybe they need couple of sessions, or some issues are very straightforward. Macam mana? How do you all go about this?
Normally I would say a 1 hour sessions that quite a lot of therapists are practicing. I find it a bit too short, but never mind, it's up to individual therapists. I normally do within like 1.5 hours. Sometimes it will be 2 hours, one sessions.
I see.
But whoever that comes in, I will actually suggest to them that a lot of question is that ask, how many sessions do I need? I said, well, we do not know how many problems you have. So it's not how many sessions that I can. You started off with a few sessions first, then we will see, how you go about it. And if the problem that you bring to us that is being solved, then you don't need any more. But sometimes we find that if, let's say, they have like anxiety, they have fear, they have insomnia, and acid reflux, all these issues that they bring in, there are underlying issues behind there, and it takes them few more sessions to settle that.
Some even take months or years also to settle.
Yeah, true. But if they collaborate with us, actually it's very much faster.
Understand.
A patient that comes in, actually we need their assistance also. They need to collaborate with us. Then the session will make it an easier going one.
Session. And have you seen like patients who come for the therapy? They come with all this acid reflux, stress, and everything.
Normally they have seen doctors.
All like haywire, and then after certain months of therapy or weeks of therapy, then maybe after 3 or 4 months they repeat their blood analysis and all. They start feeling emotionally better.
Oh yes.
And then after when they
definitely
do the blood report, everything is improved without maybe drug therapy also. I'm pretty sure
let's say I think we give an example better than
discussion.
So some people they cannot get what this meant, like fear. I have this clients that after COVID, after twice I think he has COVID, and then he started to fear. Don't know why. He can't work anymore, and every time when he's resting, then the fear comes in. Started shivering and then cannot sleep. So how to function? He's the man of the house. He has a mother to take care, wife and children, and then he owns an agency. So that's what someone recommended him to come. And then just having this fear of what? I don't know why. Why am I shaking at night? Why I can't sleep? So in the end, when the sessions gets on, we found out that he's the only son. The father died long ago when he was like 10 years old. Died. So the mother is a single mother, raised him up, very susah to raise him up. It's a Malay guy lah, yeah? So very susah to raise him up. And then of course the mother taught him to be the man, you got to take care of everything, But now at his 40s, he is like fearing death, especially after COVID. Twice already, why am I having this? And then COVID can bring death, you see. So straight away in them, it's like,
if this happens, the probability
kan dia punya perjalanan mati tu. Dia takut lah. So that's what he come. Then later on found out, he got a lot of inner child issues. Inner child issue is actually issues that in him when he was a child, because father died very young age, and he got to take care of the family and all this thing. But now because at 40, having these illnesses, that means what? His life is shortened. So how is he going to take care the whole
of
thing?
all the family, whether it will be a reflection of his parents or dad, like that.
So but this thing imprint in the brain here, that fear of death. Very automatic. It's not that what he want to think of. Although, he has seek medication and all this thing. But after, I think about 6 sessions, he finally realized, there are this fear energy that he's holding on. It's old memories that he's holding on. So help him to understand this does not take effect anymore. And you don't need to hold on to this. You can actually practically let it go and then live as a healthy person.
Okay.
Then
so
he's okay.
When you mention like this, right, this individual who datang and then they express this fear of death, right? Is every emotion different emotion kan? Adakah rawatan dia ataupun approach dia berbeza ataupun it's same different tunnel going through, or it's definitely different?
I also always give example. There are like probably, let's say, 30 cases of insomnia that comes in, or fear that comes in. But the 30 cases of insomnia that comes in, what we found out is there are 30 reasons that cause them to have this.
30 reasons. Different
It's
reasons.
different reason. So if let's say they are being given pills to solve the insomnia, it can never solve because they are using the same type of pill. So they resolve because they resolve certain issues that are troubling them during their earlier part of your life. And once it's resolved, the insomnia is gone.
Yeah, you're right. Because kalau kita lihat pada the pills and tablets or the psychotropic drugs kan, their function is just to suppress your emotion.
Correct.
But not solve or acknowledge that emotion. It's to shut down the chemical pathways that you are just ultra calm and not responsive to it. And then like, if you are dependent on it, it goes on. 10 years, 20 years, 30 years.
But we are being groomed or taught since young until now that when you are sick, you go and see a doctor, take a pill, and you recover.
True. That is the perspective. But
That's
I think when we look into especially the psychological, psychiatry kind of thing, Malaysians fear. Malaysia ni satu negara yang kalau takut nak pergi jumpa doktor psychiatry ke apa, terus takut. Dia takut akan dilabel orang gila. Betul tak?
Yeah.
This is one thing. So then one more thing, bila nak jumpa into like brain coach, mental coach to guide them, or like hypnotherapy, they still feel like, am I now half sangau, half kuku? That perspective is still in their head because they don't understand. They tak faham that these coaches maybe don't prescribe them medication, but sort of like guide them into a solution of, okay, acknowledge your deep fears, conquer it,
understanding more towards themselves as to what happened and what causes this to happen. And then when they have that realization, they overcome this already. That's it. There's no pill.
True. and so that's why I feel that there's this element kesihatan mental ni now it won't stop already.
It won't stop. It will continue to
stress
escalate.
People have, and the more we are not trained in school or certain subjects to understand our subconscious
emotion,
how to manage.
We are not being taught how to take care or manage our emotions. That is not one of the important subjects.
There's no subject.
No subject at all. So that's why they all just grow up. When I have emotion, I'm in anger, I just blow up. That's it. But actually, many cases, what we saw is actually they are harboring all these emotions. Our body is just like a vessel. We can hold on like a sponge. We can absorb. When you continue to absorb, they will definitely come to a certain level. It cannot absorb anymore. It will just blow up. So let's say for a road rage case, these people normally have a lot of anger in them, but they did not go and seek help. They didn't know they need to seek help. They thought it's normal. So the moment you bang on their car or scratch on them or slight little thing, they come out with the wood or with anything to smash you already.
Or maybe they're waiting for that opportunity because they got all of these things prepared.
Because they don't understand themselves that they needed attention, they needed to do something about their life.
Or do you think that's like on purpose, like you mentioned, when these people ada issue road rage? Kenapa mereka nak simpan parang dalam kereta? Kenapa mereka nak simpan baseball bat dalam kereta? Because the intention is almost like I'm waiting for this opportunity to create a purpose to strike.
No, normally they have this kind of fear in them because of survival. Why they are putting all these things, they are always in fear that one day what if things struck, because a lot of media, a lot of videos, they want to defend themselves. They thought so. But in the end, harming others and causing, a lot of other things. Yes. So normally these type of people, they are actually in inferior, they themselves are inferior.
Understand. What would be your message for people out there yang they have this kind of emotional issues? Some want to seek therapy, some fear, of course, some don't know where to go. What would your advice be?
I would say, okay, I like to bring this. We are using handphone now. 10 years ago you used like, let's say, iPhone. Why does the iPhone need to be upgraded, or even Samsung Android phone or iOS phone? Why do you need to upgrade the phones? As a person, are you upgrading yourself with knowledges, with things that's happening around the world, with technologies, things like that? We needed to. But many of us are like just after school, that's it. You get married, you raise a kid, then you're mothers, and you do whatever the part, but you never go on upgrading ourselves into more knowledges as to what happened. So
no time,
not at all. So because of that, so a lot of things like mental health nowadays, with things that is happening, is all suppressed since many years ago. So now you can see why mental health issue is a big problem. In fact, the ministry is also know about it. But how many of Malaysians coming out to seek help? They're still not aware of this thing. I would suggest that, let's say any one of us that got to know whoever, that there are help needed, what kind of therapy is there outside there, just tell your friend, accompany a friend. The point is, when someone is depressed or sad or grief, they will talk to many friends. These people, when they are in this mode, they will talk to many friends, but none of the friends are therapists.
Solutions.
They doesn't know. They can just say, let go, don't think about it, let go, don't think about it. But the person the moment she's quiet down herself, resting in the bed, that's where the whole thing comes. It's like a replaying memory, disturbing them. Fear, anxiety, whatsoever, worried this, worried that. Sometimes worried like 6 months down the road, things where it's not happening now,
Over predicting.
Yeah. So all these things, we need to know how to understand ourselves and to deal with this thing. But no, nowadays society is still, chasing after material wealth. A lot of them. That's part of their goals and not part of the goals of taking care of myself first.
True. And when we also look into this perspective, how do you see people who want to cross over? They want to know about their mental health. They have an issue, and their questions sometimes they also think like, can this emotion be deleted from the brain or be forgotten, or there's a place where you can put it, close it in a small packet, keep it, never to open about the story again. It is go and can that be done?
It's very good that we know about technology now, handphone or computer. Why do you have a bin there?
Recycle bin.
Why do you have a recycle bin there? Do you delete all the not needed information? You delete all this, right? But if you don't delete, it keep on compiling inside the phone. What happened to your phone?
Close down.
That phone is exactly like us. We are the phone. We are like the phone.
But aren't all memories imprinted already?
Yeah, if there's no good memories that is disturbing you, how are you going to resolve that? Because that resides in the subconscious.
Okay.
That's where the therapy happens. We go into the subconscious. What are the memories there that is causing this disturbance? We sort of cleanse it or delete it. It's just that the memory will still be there, but it's just that it's not active anymore.
You don't go and open it. You always don't go and reflect on that.
But if you don't delete or cleanse it, whatever circumstances or phenomenon that you face or you saw, it will
come back,
ignite. Like, I have another patient. I don't know why recently I keep on thinking suicide. I don't know why. I just don't know why this thing is so strong in me. Then after questioning, looking at the history, recently, every time I open the Facebook, if whatever that, like you like singing, the search engine will go into that, right? Recently, he saw a lot of commit suicide jumping down from the building one. So that memory comes in. So that was one of his past memory. So what happened to him is, whenever he go out to a mama sitting down outside, he feel fear. Don't know why, some kind of fear. Any restaurants, any place, any makan place, he will have fear one. Back home, no fear. But outside makan, have fear. With family, with colleagues, with anybody, he will have that sense of fear one. So during hypnosis, managed to
understand that.
Bring him to understand that actually at one point of a time, one life, he actually committed suicide. So once he understands and he knows this memory in there, so it's a past memory, but you still bring it into now like real, you see. So we help them to delete this memory, So then it's past anyway. You don't need this memory anymore. You are living now with a different person. You are present. You are a new life now. You are this new person now. So it does not, affect you anymore. The moment he realized this, he don't have that anymore.
Wow, that's like opening another world of the metaverse, going so deep. I think, but there is definitely a connection between our body, mind, and spirit in our bodies. We cannot deny that. We cannot deny this element, and we people in the medical field, we need to learn to acknowledge a lot of things. We need to acknowledge that just like taking one simple drug, it's not going to fix someone's emotional situation. I think we need to listen to them, give them 2 pairs of full attention and ears to listen to what they see, and then see what kind of mode of therapy they need. Some maybe need medication. Maybe they are in a medic position.
Yes,
There's no choice.
yes,
We have
there's
to
no
give
choice.
medication.
Yes, sometimes.
Some people don't. They're not in that position, but they are like maybe having a broken heart syndrome, a very bad separation,
Yeah.
and
Correct.
they need someone to listen to them. Maybe as an expert, like a proper therapist, not like 10 of their girlfriends who will like probably like
Relationship issues.
disturb them, insult them again. Like, no, you should have not gone with that guy and this and that. And see what happened after 3 years. He separated, all of these kind of things, and then they feel that it's getting more worse because now my community accepts me like a loser, or you are a failed product of the society. That makes it even worse. So
Yes.
always seek expert advice.
Yeah.
Always
There
seek
is help out there.
Yeah, there is help
actually,
out there.
yeah, there is help out there. Whoever that listen to this and you got to know about this, you can actually now at least when your friends talk to you, you can direct them to seek proper help from therapists or doctors. Yeah, some of them they do this. So sometimes you can do a little bit extra by accompany them there. They just want someone to be with them.
Just support them.
To support them. Yeah.
Faham.
Therapy is nothing fearful. The fear part is you don't step out from your zone to face the problem that you have.
True. And nak tanya juga, hypnotherapy ni boleh buat secara online ke tak?
Yes, there are a lot of people doing it, but I still
Face to face.
prefer face-to-face because very individual. Why? During hypnosis, sometimes they will aberrate. So when they aberrate, there's a sign of reaction in them. That's where we need to be there to actually calm them. Yeah.
Understand.
So if they are at the other end or in the
Far away.
house far away, so how are we going to
Understand.
calm them? Or sometimes the line cut off. They are actually in the sessions.
Interrupted.
Yeah. I
Because
don't.
of lightning. Macam Astro.
yeah. Once rain,
No
you get
siaran.
disruption, tak ada siaran, cannot get it.
So jangan buat hypnotherapy secara online, okay? So a few one more last question before we conclude. I wanted to ask also, when people do this kind of therapy, right? And they are in that whole journey, right? In the whole journey of maybe a couple of sessions, right?
Yeah.
Do they have homework?
Oh yes, we will normally guide them. Yeah, after the sessions, we will actually guide them with some homeworks that they need to do at home. Sometimes it's exercises, that we give it to them, and then when they come back, we will see whether they do it or not.
It's not
normally,
like, some of them I heard is like audio. Some of them are like we say like breathing.
they need to
thing.
learn how to do the calming down, make
By their own.
themselves, soothing, then how they actually can go into the level that can probably ease them. Then when they themselves are actually at ease, actually problem is not so great anymore.
Understand. So where do we find you? Where do you practice at the moment, and how do people get in touch with you?
We started off in Pantai Therapy Bangsa.
Okay.
Yeah, but then we moved out from there since 2021, and now we are actually in the Filio Damansara.
Philo Damansara.
Yeah.
Okay. So anyone needs to get you, there's a telephone number to get in touch with you, right?
Yes.
It's 603-7932-1680.
Yeah,
Okay.
or call my phone direct because
Okay.
normally they wanted to inquire how they can go about these sessions, and like I say, how many sessions do I need? Then we will explain to them.
Understand. Don't worry, we will put the telephone number dekat bawah nanti, akan tertera, dan juga dalam link kami akan sediakan untuk sesiapa yang ingin tahu ataupun perlukan bantuan hipnoterapi untuk selesaikan masalah-masalah kesihatan mereka, sama ada fizikal ataupun mental dan juga emosi dia.
Yeah.
Okay.
Apa yang kita buat banyak ialah dalam perkarangan emosi dengan mental dia orang, because these are the two parts there that a lot of people because this emotion management thingy has been not being taught when they were young. So even up until now, you can see some of the old age grandmas, why they turn into like childlike behavior as they age. So what in us, we find that they have a lot of inner child issues that is not resolved. That's why you can see them going back to the childhood time. So it's actually a childhood problem in them that is not being fulfilled. So now, as they age, this thing comes about.
Great. Okay, Jean Keong, thank you so much for being here today. Terima kasih kerana datang ke Lesung Batu Medic Show. So, siapa sekali lagi nak jumpa Jeannie Keong, boleh pergi kepada search Pantai Therapy Center. Location dia dekat Filio Damansara 1 dengan telefon nombor 0379321680. Okey, sekian saja untuk episod kali ini. Semoga penerangan dan discussion kami tentang hypnotherapy ni bermanfaat kepada semua. Sekiranya terdapat apa-apa kekurangan, kami mohon ampun. Tapi jangan lupa like, subscribe, share Lesung Batu Medic Show di Facebook, YouTube, TikTok dan juga Instagram. Sehingga kita bertemu di episod yang akan datang. Kita lesung kau-kau.